Hi, I'm Mitra. I'm one of the GPs here at Lloyd's Pharmacy Online Doctor. I'm here to talk a little bit about irritable bowel syndrome, or IBS. It's actually estimated that as many as 1 in 5 people in the UK will experience IBS at some point in their lives, so it's pretty common. And the good news is there's lots of ways you can relieve the symptoms. So what exactly is IBS? Well, put simply, it's when the function of your gut is unhappy. This can cause symptoms like tummy pain, cramping, bloating, diarrhea and constipation. Some people also experience things like feeling nauseous, passing more wind, tiredness, backaches, needing to wee more often, and passing mucus from the bottom. The causes of IBS are not 100% clear. It's thought to be caused by a number of different things. For example, a severe infection in the gut, stress, emotional upset, changes to your gut microbes, and in some cases, an intolerance to certain foods, but this is thought to be rare. The causes of an IBS flare-up can also be varied. Certain foods like wheat, dairy, beans, cabbage, and fizzy drinks are thought to trigger IBS symptoms. Stress is also thought to worsen the symptoms of IBS. This is because the brain and the gut are closely linked. Think about the symptoms and sensations you experience when you're stressed, like knots or butterflies in your tummy, muscle tension, and maybe needing the toilet more. This can all damage the gut and worsen IBS symptoms. So what should you do if you think you have IBS? Well, the most important thing is to speak to your GP first. They should be able to assess you and do some tests to work out if you have IBS and not another digestive condition. The GP might ask you what symptoms you have, how frequent they are, and when they flare up, for example after certain foods or situations. Before going to your GP, it might be useful to have a diary of your symptoms, noting down what you ate and drank that day, any exercise you've done, or anything else that happened in your day that might have affected your mood. If your GP does think you have IBS, there's no one treatment or diet that works for all, but there are lots of options to try. If you experience wind, bloating and cramps, try eating oats regularly and up to 1 tablespoon of linseeds a day. Try avoiding foods that are hard to digest, like sprouts, beans, onions and dried fruit. You could also try things like peppermint oil or buscopan to help ease your symptoms. If you experience constipation, you should try drinking lots of fluids and increase your intake of soluble fibre from foods like oats, pulses and linseeds. But if your IBS mainly presents as diarrhea, you need to cut down on fibre in your diet. You can also avoid a sweetener called sorbitol. There are also some lifestyle changes that everyone can make that should help, like using fresh ingredients when cooking where possible, staying hydrated, getting plenty of exercise, and trying to minimise stress and focus on getting a good night's sleep. Thank you for listening, and I hope you found this useful.